Yokwe, I'm Johnson Raela, and welcome back to the Pacific.
Talofa, ulufale mai, I'm Alice Lolohea. Let's take a look at what's coming up on the show.
Global fuel issues stifling the Pacific. We hear from a U.S. Congresswoman on the crisis in the Northern Marianas.
A grieving mother's plea to Vanuatu's health authorities.
And the game of chess inspiring young people in Port Moresby's Girihu.
Chess in the hood!
First though, Alice, there's been some major weather events in our region this week.
That's right, Johns. Not one, but two cyclones have been wreaking havoc in the Pacific. The first, severe tropical cyclone Maila, was at one point a Category 5 storm with wind gusts of up to 295 kilometres per hour. The cyclone battered much of Solomon Islands' western and Choiseul provinces with strong waves and gale-force winds. Online videos and photos showed damaged houses and buildings, along with flooding in other areas. Cyclone-driven waves pushed their way into villages along the coastline and inland. The Solomon Star spoke to market vendors in Gizo, many of them from outer islands who've been stranded at the market since last week, unable to travel due to the weather. The Western Solomon Islands police chief says the damage from Maila is the worst the province has experienced since the 2007 earthquake and tsunami. Prime Minister Jeremiah Manele activated national disaster management responses and says any further action, including a declaration of a state of emergency, will be guided by further assessments. The cyclone made its way towards Papua New Guinea, where officials in Lolohea province warned they were unprepared for a major storm. Preliminary reports indicate some families have been left homeless after their houses were blown down by strong winds, which also damaged crops.
Most of the crops have been uprooted, and some mentioned we survive on the vegetables. Once the cyclone damaged all these garden fruits, I don't think we'll survive. Since Cyclone Maila is the best of its kind that hit the island, people are now living in fear, and after the cyclone they don't have any hope.
Over in Fiji, a second storm, Cyclone Vanuatu, didn't make landfall, but it brought heavy rain and flooding. Many domestic and international flights were cancelled, and Sydney passengers from a Fiji Airways flight were diverted to Tonga after extreme weather conditions thwarted 3 attempts to land in Nadi.
Thanks, Alice. Now, news of a 2-week ceasefire in Iran may offer some hope to Pacific nations as the global fuel crisis begins to bite. Donald Trump has agreed to pause strikes, but it's unclear whether the vital Strait of Hormuz will fully reopen, and petrol pressures are likely to persist. New Zealand is urging the US to send fuel tankers to ease the strain in the region, but as uncertainty drives prices higher, communities are struggling. In Fiji, there's pressure at the fuel pump.
This one cost us a lot. So expensive, so hard for living now.
Just 3 weeks ago, Fijians were told there was no reason to worry.
There should be no price hike. There's no need for any price hike because there's no need to panic yet.
But there's now been a dramatic rise in prices, and it's hitting everyday people.
Oh man, can't say much about this. It's really affecting us.
After weeks of fighting in the Middle East and the closure of a key shipping route, the price of oil rose to more than $100 a barrel, pushing diesel prices up in Fiji by 35%, putting pressure on those relying on it for their incomes.
Definitely the price of the fuel is going up, and taxi fare remains the same. It will be very difficult to cooperate with the income now. The expense, the cost of living will be very high now.
Fiji's government says the supply of fuel is stable, but has warned that prices will keep rising if the war restarts and drags on. Around 80% of the Pacific's energy comes from imported fuel, powering homes, shops and transport. Solomon Islands already has some of the highest electricity prices in the world, and the Prime Minister is urging the country to prepare for bigger bills.
Our farmers will be affected. Our shipping operators, boat operators, consumers of electricity.
While the rise in prices has been slow, they're starting to hurt local shipping operators that transport people and cargo across the country. They say fuel is their biggest expense.
We're very concerned because we connect our urban town, mainly Honiara, to the islands. So any costing that we pass on to our customers will have a direct impact on them. We just have to expect the unexpected.
And along the shores of Timor-Leste, fishermen worry how much the next catch might cost them.
Maybe kami usa mesin boat, maybe kami sa hetang ikan, skem sosa meminare. Atu diang rai duni, atu diang rai peratu hang himunene, aras ketuan tama mina makaruliu.
Once a major oil and gas producer, Timor-Leste's reserves have run dry, and now the country is forced to import the very fuel it once exported. To ease the pressure, the government has put a cap on prices and asked people to walk or bike to save fuel.
I managed to ride a bike every Friday and then bike to work.
Over in Tonga, the Prime Minister joked that people might soon have to trade in their cars for alternative transport.
E ko hiu ki to ia tau whiri. Kone maha koe tange, kone maha e tange. Ai ton ke tau whakaukau ki he whangamon manu. Yo toi kai ho si ka tau tānaki au.
But behind the humour, Lord Whakawhanua is eyeing up dwindling fuel supplies, admitting that by May they could be in dire straits.
We're in a pretty good place for the next 2 months, and anything beyond that will be crystal balling.
He, along with other Pacific leaders, have appealed for help from Australia and New Zealand to prepare for fuel shortages. And New Zealand's Foreign Affairs Minister Winston Peters has asked the US to send fuel tankers to the Pacific.
We're able to ensure that our part of the world, not just New Zealand, but the Pacific, is not forgotten.
And while New Zealand is calling on Washington to step in, one of America's own Pacific territories is being pushed to its limit. In the Northern Mariana Islands, load shedding is on the table as fuel prices surge, costing the territory $140,000 every day. The high price of war now felt across every corner of the Pacific. To unpack this further, we're joined by Kimberlyn King-Hines, a Republican U.S. Congresswoman for the American Territory of the Northern Marianas. Half a day, Congresswoman, and thank you for joining us on the Pacific.
Half a day, Tiro from the Northern Marianas.
Firstly, a 2-week ceasefire has been called by President Trump. What's your response to the news?
My response to that news, obviously as somebody who lives on the westernmost border of the United States, closest to China, who is living the economic realities of what geopolitics, the impacts of geopolitics, I'm all for peace. My focus is to try to figure out how I can bring relief to the community as a result of the impact of these larger national conversations.
Now, how bad is the fuel crisis in the Northern Marianas right now?
It's terrible. It's backbreaking, really. So, just to give you a little bit of context, our economy's already struggling and on the brink of economic collapse because our tourism industry has not returned to sustainable levels since the pandemic. And then, now you have this global event that happens. And so we feel it here first, and we feel it the hardest because we live in isolation, which means, we're dependent on imports. And so when global instability hits, it directly impacts the cost of living here and the strength of our economy. And this is really testing it. Our utilities company has just shared with the community and key stakeholders that, fuel costs has doubled, which means they have to double the utility rates. And so when you double the cost of utilities, now people are having to choose between, having medication or not having medication. When global events shift, it is the people who live in this geography, this part of the world, who feel it fast, who feel it first and who feel it the hardest. And for many of us, this is a very serious situation, and the focus needs to be on finding immediate relief, and that is what we're working on.
Now, 2 weeks ago, you went to Washington to address the rising fuel costs in the Marianas and across Pacific territories. What was their response, and has there been any practical solutions or help offered?
At the end of the day, you kind of have to make a showing to the federal government that this is the actual impact. Every time I come home when Congress is not in session, there's a business that's closing down, aside and separate from this fuel situation. This is just further exacerbating the problem. And so, the focus really is how do we put our heads together, move around some resources to buy us temporary relief so that these rates don't double because businesses can't afford it. Plain and simple, they can't afford it.
As a Republican, do you support President Trump's stance on the war?
There's a lot of people who want to comment on that. There's no shortage of people who are going to debate that issue. My focus is really, how do I bring relief? How do I bring relief today? Because I'm going to tell you this is a life and death situation. If the government does not buy additional fuel, the hospital will not run, the schools will not run, right? And so that's the focus.
Yes, but they're also spending a lot of money on the war, which could provide relief to CNMI.
Well, that's for, the president to decide. That's within the realm of his authority. My job is to figure out how I can bring help to the people I represent.
Now, Congresswoman, the fuel crisis has also ramped up the discussion around transition to renewable energy. Has this crisis exposed how Pacific territories might be too reliant on fossil fuels for their energy supply?
Well, it's basically geography, right? If you're living in a remote island community in the middle of the ocean, you're going to rely on imports. And right now, we don't have multiple supply chains to be able to access fuel, or we don't produce our own fuel supply here. And so, there needs to be a larger conversation about how to actually address this issue, not just because of the ongoing crisis, but, for the long-term energy sustainability of these islands.
Now, lastly, the President signed an executive order to accelerate the exploitation of seabed minerals. This was last year. But deep-sea mining of the U.S. Pacific territories, including the Marianas, could be on the horizon. Do you support this?
So, Kim Hines, the human being, has her own personal opinion. But I'm not here to represent my own personal opinion. I represent this community, and this community has come out overwhelmingly and has stated that they have deep concerns about seabed mining because of our cultural ties and, to the ocean, right? As Pacific Islanders, we just feel differently about the ocean. It's tied into our identity. It's tied into who we are. And this community has chimed in on that topic. I've expressed this community's opinion with regards to that issue in committee meetings in Congress. I'm there to get people's voices from the Commonwealth heard across the halls of DC.
Congresswoman Kimberly King-Hines, thank you for your time.
Thank you very much for the opportunity to have a conversation.
Moving on to an issue we know many people in our Pacific family are grappling with: access to adequate, affordable healthcare.
Today, we head to Vanuatu to meet a mother who's endured the unthinkable, the loss of her beloved daughter.
But as she explains, her daughter's experiences in Vanuatu's health system and the huge financial cost of taking her overseas for treatment made a heartbreaking situation even worse.
This story by Lily Rose Wawau.
Hello. We just live inside one room now.
She was my only daughter among 3 boys. She has this personality that's, it's contagious.
Fern Napwat's 13-year-old daughter Tidri, known to her family as Sneaky, loved flowers and her friends and family. But Nikki's life was upended in June 2025.
She told me, Mom, there's some sort of bruises in her mouth, and then there was a big red dot inside her eye.
An early morning trip to Vanuatu National Hospital found her blood at critically low platelet levels. After hours of waiting, Fern was told Nikki needed a blood transfusion, but there was no blood in the blood bank.
Oh yeah. I was really frustrated, upset, and I told her, okay, we came first thing in the morning. You could have done this in the morning.
Nikki's family mobilized to donate blood. And once she began transfusions, doctors said they began tests to find a diagnosis. That included an analysis of Nikki's bone marrow, often used to diagnose leukemia. Fern says she was initially told it could be analyzed in Port Vila, but days later it was revealed the sample had been sent to Australia.
It took weeks. And then during that period, my daughter was getting, sick every time.
Despite the delays, Fern says doctors reassured her.
Every time when we asked the doctors if going overseas was an option, they'll be like, no, but we can fix this.
But that never eventuated. After around 3 months of treatment, they told Fern Nikki had an infection and her treatment options had run out.
She told me that her body is not responding to it, and then there's nothing else that they can do for her.
Deciding she had to do whatever it took to try and save her daughter, Fern took Nikki to a hospital in Haryana, India, where she was quickly diagnosed with leukemia. She was also told Nikki had hepatitis B, which Fern suspects may have come from the blood transfusions, though the source has not been confirmed.
The blood test had shown that it was introduced into her body. And they asked me if she was getting blood transfusions back in Vanuatu, and I told them yes, she had. It was one thing that really contributed to the aggressiveness of the leukemia.
Despite chemotherapy, after just a few weeks, doctors told Fern for a second time that there was nothing they could do to save her daughter.
That was the last time she looked at me. So that was when I lost her. It's an experience where you will never want to go through. You don't want to eat, you don't want to think, you don't want to wake up. And the fact that you're alone, it's indescribable.
Fern now faced the grueling task of getting her daughter's body home. With donations from family and friends, Fern says she spent nearly 100,000 Australian dollars on treatment and repatriation. And while she understands the challenges facing Vanuatu's health system, Fern believes the urgency of her daughter's condition was never prioritized.
I actually took my very sick child to the hospital with the belief that, once the doctor sees her and then is able to tell me she is sick and this is what it's called and then this is the treatment.
Do you think your daughter would still be alive if she had gotten the treatment she needed?
Yes.
I've come to Vanuatu National Hospital to meet Dr. Sale Voroparafu.
Our biggest challenge at the moment in Vanuatu is lack of manpower. I think we're sitting at 40 or 50% capacity. And at the hospital, it's used for 500 nurses. And within the system, we probably need 300 doctors. So it's like the saying, a table cannot function without 4 legs. And currently we only have a table with 2 legs to run a service. So it's a very shaky and wobbly table.
He says understaffing has led to huge pressure on specialists.
There's 2 of us, but there should be 5 specialists. So we can take turn doing night shifts. There's issues like burnout, sleep deprivation, having to deal with a big workload. These experiences are shared amongst all the healthcare workers. You can have a brand new AusAid-funded health center, 20 million Vatu, all the latest equipment. But if you don't have that healthcare worker, it's just like a museum.
For the Vanuatu's Acting Director General of Health, Dr. Santos Wari, he concedes doctors needed to do better in Nikki's case.
So that means if they don't have the capacity to do diagnosis, is it their responsibility to communicate that to the patients?
We can't compromise. I mean, the safe game is, if I cannot do it, it's important. I say I can't do it.
In Nikki's case, will there be an investigation into her case?
I won't know. I mean, maybe there will be an investigation. I won't know. I mean, that's a possibility.
However, he agrees staff shortages and a lack of reliable medical record keeping have left healthcare here wanting.
I know in Vanuatu, our expectation is high, and that's all right. In fact, we have a lot more work to do to meet those expectations.
Dr. Wari says he hopes a new cancer treatment center to be built by the end of the year will form part of that work.
We are very ambitious to make sure those gaps, big gaps in knowledge and skills, we narrow it down.
Okay. So this is her room.
For Fern and her family, the reality of life without Nikki is still sinking in. But the family is determined to ensure her dad wasn't in vain.
The experience that I went through, that my family went through, we wanted to change, to be able to assist families, children who may be going through, having the same type of sick, but then they don't have the financial support.
In the future, she hopes to be able to improve the outlook for children like Nikki.
I'm not going to accept another child who's going to die from this disease. That's why I believe that we should do something.
Powerful reporting there from Lily Rose Wellwell, and thanks to Gabriella Marchant for helping produce that story. A change of pace now because, Alice, some exciting news for fans of Pacific films.
That's right, Johns. 3 Hollywood heavyweights have teamed up to acquire an Aotearoa-based film studio, which they hope will boost industry jobs and become a place to champion Pacific storytelling. For almost 30 years, Auckland's Studio West has attracted television and film productions from around the globe. Now the studio's reins will be handed over to 3 of Polynesia's biggest names in film: Jason Momoa, Cliff Curtis, and Academy Award-winning filmmaker Taika Waititi. The trio have purchased the studio in a move they hope will bring more jobs and Polynesian talent to Aotearoa, New Zealand.
And this is an Indigenous-owned studio, and uplifting, well, actually not just our people, but, people in the industry, because, the industry's been under some pressure. It's been suffering a little bit, and I think that the more we focus on trying to get more work here and bring things here, hopefully creates more of that interest.
Studio West is no stranger to major Hollywood productions. Most recently, Jason Momoa's Apple TV series Chief of War was based there. Momoa says he hopes the acquisition will help champion stories that deserve to be seen and heard around the world.
At the start of 2024, Papua New Guinea's capital Port Moresby was thrown into turmoil as civil unrest swept through the city. Gerihu was caught in the crossfire.
But in a suburb where the odds have often felt stacked against them, instead of staying cornered by its past, the young people of Gerihu are rewriting the playbook, this time armed with chessboards instead of bravado.
I had no idea about chess. I would say I didn't know this game even existed.
I think it can be hard, but if you have a good community of people to play with and to learn from each other, it makes it a lot easier.
They see the pieces all over the board and they think it's very easy.
Chess in the Hood began late in, I'd say, mid-May of 2024. From there it started as a small group, just us brothers. It was mostly boys. But then over time, we wanted to promote inclusivity and get as many young as well as females to come and enjoy the game and understand its values.
Since I joined, the boys have been really welcoming, and they have been good mentors also, teaching us, learning new things. So we are like a big family in the community.
I'm actually a disability advocate. I have my own page, just sharing stories about myself. It takes a village for a disabled person to shine. I see that chess is a great avenue for myself to come out and be with people and the youth. Wow. Like in the beginning, it will be really hard. But like a lot of people, they see the pieces all over the board and they think it's very easy. But once you get into it, it's another world within itself.
I think the work that they've done is quite a fantastic job that all other new clubs would aspire to or should aspire to. I've seen a lot of change from the youth that have been taking part in the sport here, a lot of their attitudes changing.
Out of chess, our boys have come up with initiatives like neighborhood watches. They've stopped with all these negative influences, especially with drug abuse, alcohol, all the bad stuff. And they've looked at chess in a positive way, not just in trying to teach its values, but also help them, contribute something positive back to the community.
So chess is mainly a male-dominant field. So being the only female to try the game and all that, it's really challenging and it's interesting. So I would encourage a lot of women or girls in the community to join.
I would say the challenges we faced, it's mostly with financing and resources, but growing up here, we've learned to try and adapt and utilize whatever resources or skills that we had as individuals or as a group. We want to keep the momentum going because we feel that if it's given time, people will see the results. Chess is a slow game, but when they reap the harvest, there's more.
Chess in the hood!
Straightforward.
Can you play chess?
I can't, unfortunately.
Yes, I can tell. And even if we played off against each other, I would win. And that's our show for another week.
You can rewatch our show on ABC iView and all our stories on ABC's YouTube channels.
Keep up to date on news from across the region on ABC Pacific platforms. Ka kite.
Bye.